Now I'm just telling you again the photograph of the foreigners gangrene what I came into the screen. Actually, he was more or less healed already. The skin cover was completed, more or less. And he did not come to me. He used to dress the wound. He came to me after 22 years. When I treated him, after that he came for 22 years. After 22 years, he came and he had a enlarged prostate problem. And he was catheterized by the Rampurat Medical College. But yet he had faith in me and he came to me. The completed story has been down with me that I have taken a video and also the skin texture is become normal only except the pigmentation is not completed. It can happen in burns and all. It is the whitish, a patch of whitish is there. But the texture, feel of this scrotal skin was normal, absolutely normal. And honey has such a thing that it does not produce scar. Okay, now today we have only one single specimen at present of the testes. I've just run through the illustration. Now you can see this is the testis. This testis, this is epididymis, the scrotum, the scrotal layer, this is the penis. Now, testes. The testes are the reproductive glands of the male and are equivalent to the ovaries in the female. They are about 4.5 centimeters, 2.5 centimeters wide and 3 centimeters thick. They are suspended in the scrotum by spermatic cord. Now, they are surrounded by 3 layers: tunica vaginalis, tunica albuginea, tunica vasculosa. Now, you can see this is a section. Now, this is the parietal layer, this is the cavity, and visceral layer, tunica vaginalis, capsule, tunica albuginea, and these are the seminiferous tubules, straight tubules and coiled structure. Structure of the testes. Each testis, there are 200 to 300 lobules. Within each lobule are 1 to 4 convoluted loops composed of germinal epithelium cells called seminiferous tubules. Between the tubules are the group of cells called interstitial cells of Leydig. You will see in the histological slides. Okay. Interstitial cells of Leydig secrete hormones, testosterone after puberty. The male hormone. Now you can see the skin. This is the tunica vaginalis testis here. The tunica vasculosa, tunica albuginea. Now, if you take a testis and make an incision, you can see the seminiferous tubule because if you are to take your testicular biopsy, you can see it, or you doing an operation for hydrocele or some pathological condition, you can see the thing. Now you have to see the anatomy. Anatomy of the thing, testis is that this is cross section of this one. At the upper end of the testis, the tubules combine to form a single tubule. This tubule forms 6 centimeters long and repeatedly folded and tightly packed to form a mass called epididymis. It leaves the scrotum at the ductus deferens in spermatic cord. Blood and lymph vessels pass to the testes in the spermatic cord. Now, this complex this thing spermatogenesis. This different that won't be discussed today as such. Now, you see The this is scrotum, this is penis. Okay. Now, this is spermatic cord. This is scrotum. These are the testes. Now, the seminiferous tubules, it opens into the prostate. In the prostate it goes, and from there prostatic part of the vesicles, prostatic urethra. Now prostatic urethra through the urethra, penile urethra. Now this is the this spermatogenesis. It is a complex series of changes by which spermatogonia is transformed into a spermatozoa by reduction, division and genetic recombination. Now this is the picture of how it goes about. Type A spermatogonia, stem cells. Type B spermatogonia. Now mitosis, this is the mitosis. Now primary spermatocytes, first mitotic division. Secondary spermatocytes, second meiotic division. Now spermatogenesis, this whole process is known as spermatogenesis. You can see the residual bodies and the spermatids are here. And residual bodies are here and the spermatozoa. This is spermatozoa and this. Now spermiogenesis, see these are the cells, the mitochondria, nucleus, Golgi bodies, acrosomal vesicle and acrosomal cap. This is the result of the spermatozoa. Yeah, I think. Now you see the spermatozoa. Head, body, tail. See, scanning electron microscopy of sperms. Head is completely filled with nucleus, filled with DNA. It also contains enzymes required to penetrate the outer layer of the ovum, reach and fuse with its nucleus. In the term dermis, there is a thin layer of smooth muscle known as Darto's muscle. Contraction of this muscle causes wrinkling of the skin. The cremaster muscle is a thicker layer of skeletal muscle that lowers and raises the testes based on temperature. You can see the testes here. Now, inside this scrotum, each testis is enclosed by tunica vaginalis. Here, tunica vaginalis. Now, peritoneum that lies the abdominal pelvic cavity, a fibrous capsule covers each testis called tunica albuginea. Testicles, now the tunica albuginea gives rise to septa, partitions. Okay. And that divides the testis into lobules, about 250 lobules. Each lobule contains 3 or 4 highly coiled seminiferous tubules. These coverage to become a reti testis which transport the sperm to the epididymis. This is the epididymis. This is the reti testis. This is the reti testis. Now you can see the seminiferous tubules. You can see the spermatic cord contains the structures running from the testicle to the pelvic cavity, passes through the inguinal canal, contains the vas deferens, nerves and blood. You see the ductus deferens or the vas deferens. Now, when you are performing a hydrocele of a child, pediatric surgery, then you have to note the spermatic cord. A dissection then spermatic cord will be cut off. So you have to have a very gentle handling of tissues. Now, see, this is the appendix of the epididymis. This is the epididymis. Testis covered by visceral layer, tunica, vaginalis, testis. Now, the parietal layer of tunica vaginalis. Now, accessory glands, seminal vesicles. This is the posterior wall of the bladder and 60% of the volume of semen. Seminal fluid, fructose, provides energy for the sperm. Fibrinogen helps to turn semen into a bolus that can be readily propelled into the vagina. And prostaglandin decreases cervical mucosa viscosity and stimulates reversal peristalsis of the uterus. Join the duct difference from the ejaculatory duct. Yeah. The location and this is the left ureter, this is the bladder, this is seminal vesicles. This is the ejaculatory duct. It releases in the prostate here. The prostatic urethra, I told you, urethral membrane, crus of the penis, here crus of the penis, bulb of the penis, and corpus spongiosum of the penis. Axillary gland, the prostate gland, এটা কালকে হবে. Now, internal structure of the penis, the cord, and you can see this is the head of the epididymis. This is a ছিঁড়ে ফেলবে না, দেখতে গিয়ে gently handle. Okay. Now, this is the, now hold it like this. Now, if you open the layers, then the head of the epididymis and there's a cleft that should be directed laterally. When you are doing a hydrocele operation or any assisting a surgeon, you have to demarcate and see this cleft. The epididymis is just placed like this. So there's a cleft because it's coming from here and then going into the destination. Now, this cleft that can be a torsion, small torsion like this, or it can be like this, like this. So, what will happen? After post-surgery, the analgesic effect is gone and all, for some anesthesia is gone, and acute pain, it can be due to the surgical pain, or it can be you have to note and see that if it is your error in the testicular, when you're putting into the scrotal cavity, the testes, that time it got torsion or not. If slight half twist can also create a danger. Then you reopen and see how it is. If it is, you see that it is not blackish or some color change is not there, then you can try and keep it. But whatever you have to diagnose is that you have to say it, that directly you have to assess and diagnose that if there is a torsion of the testis or not.